please tell us about your company, Plano, and about yourself.
Okay, so a bit about myself. So I'm Australian born to immigrant parents from Lebanon. I'm one of 12 kids. And I was born and raised in Sydney to my childhood years, and then went over to Melbourne as a young teenager, and went off to study at the University of Melbourne, where I got my PhD in the Faculty of Medicine, Department of Ophthalmology. So basically a PhD in research centered around the epidemiology of myopia. That was a little while ago. I'm not going to tell you how long ago because that'll give away my age, but nonetheless, I graduated there at the young age of 26 in Melbourne, and then developed quite a competitive research career, and I still hold adjunct positions, the latest as an associate professor at Duke-NUS, an honorary position at Singapore Eye Research Institute and the Centre for Eye Research Australia. So from there, I made a small or a major pivot where I tried to understand how we can best translate our research work into real life solutions. And that was the big motivation of actually becoming more engaged and aware and conscious about thinking of metrics, if you like, beyond that of what you do in academia or research. And so, you know, that's heavily driven on manuscript publications, grants, presentations, student supervision, and so forth. But you know, I was very eager to try and understand how I can help big populations using science-based solutions. And so this is where I was able, the penny dropped 3 or so years ago, and I was able to sort of tap into my connections here in Singapore, particularly that at the Eye Centre. And I evolved this concept of Plano that I had in my mind at their incubator. And really what I wanted to do is that I want to understand how we can, you know, using innovative ways and solutions, how we can tackle the big global problem of myopia or short-sightedness, which is projected to affect about 5 billion people, or half the world's population, by 2050. And currently it's close to 3 billion people with myopia. And we know that a significant proportion of those actually fall under a category where they're at risk of developing sight-threatening, in some cases blinding cases. So this is called the high or pathological myopia. So it's not just a condition that you throw a pair of glasses on. You know, it's a serious eye disease. And so I thought one of the key reasons I tapped into myopia is because I knew the world was becoming more and more digital, and the time we're spending on our screens and the less time outdoors were clear risk factors. And I thought there was going to be a linear or some sort of parallel relationship with digitalization, dependency on screens, and myopia. And so I thought, how can we potentially address this? And the second was underutilization of healthcare. One of the biggest problems we find in epidemiology or population health or public health is the lack of utilization of health services, even in affluent developed places. You know, and this is why you would see a lot of campaigns and ads and other sort of educational models of trying to get, you know, your teeth checked regularly, and breast screening, for example, regular health checks for your heart. And so, you know, eyes is no different. So we know there's a whole heap of undiagnosed cases out there. We know there's an underutilization of services, even though the services are there. And this is not tapping into places. This is not tapping into the space of, you know, under-resourced and under access, you know, issues with access and so forth. So how can we address myopia as one of the big global problems and underutilization of services in an innovative way? And this is where the concept of Plano was developed. You know, falling under the category of a health technology company, which is, you know, in essence, trying to help people achieve their best vision and eye health through education. And education is absolutely important, sustainable models of education, and of course, through science-based technological solutions. And so this is the concept of Plano, and it's got three clear arms. And the first one is education awareness. The second is tech solutions, and we can talk a bit more about the application that's available in 10 countries and has been sort of trusted by almost 500,000 families around the world. So that's quite nice. And the second tech solution is that of a platform, a very smart platform that enables people to make eye appointments and attend appointments, eye appointments in an efficient, effective, and impactful manner. And so this is a proven model that's been responsible for getting thousands of people into eye care in Singapore alone. So we're quite excited about that. And this is truly demonstrating that technology can be part of the comprehensive approach when tackling health problems, and not just that in surgical tools or in diagnostic tools, but actually in education and awareness and in facilitation of getting more traffic into eye care and healthcare in a broader sense. So education and awareness. Number two, we spoke about tech solutions, and number three is AI. So how can we predict disease, and how can we really engage with partners in the world, whether it's hardware, telecommunications, mobile devices, and so forth, in the Internet of Things. So that was a little bit about me from a professional standpoint, and a bit about the company. And I'm just very fortunate that I'm the mouthpiece of this, but it wouldn't be possible without. I'm sure we're going to talk about partners and shareholders and stakeholders and team and so forth later on, but this is where we are currently.
Definitely. And you've had like research-based, research-oriented career, but you also did your MBA, if I'm not wrong, and you founded Plano right after your MBA. So like this, the idea of Plano was there at the back of your mind before, or did you get inspired to like found your own company after completing your MBA?
Yeah, I don't think there was any structure to, there was no expectation from undergoing an MBA in the sense of once I'm done, I will then have a crystallized idea of a venture. What it was that it was part of the journey, and so 5 or 6 years after my PhD. There was clear frustrations I had as a competitive researcher, and the frustrations is that I personally, and I'm only speaking for myself here, I didn't feel like I was contributing to society at the level that I wanted to contribute, and that was having direct impact in people's lives in a positive way, using my ability to critically think, to be able to, I thought I could innovate. And I knew I had to bridge, I knew two things. I knew I had to bridge the gap between academia and the rest of the world, particularly industry. And the second thing I knew I had to do was I had to speak to people outside of my academic circle, because it's important to obtain different perspectives on particularly solution-based approaches. And so they're the two things that I knew I had to do, and I needed real life experience in the world of business. And so I did actually go out and develop a couple of small ventures, and at a very small scale, just to get that real life experience from conception all the way to consumption from consumers. And then the MBA, I thought, and I did that while I was working. I had a full-time job heading a department and heading a major national eye health study in Australia. It was a team of in excess of about 50 to 70 people. It was quite an undertaking, and I was running marathons at the same time. But that MBA really it gave me the correct jargon. It put structure to some of the chaos in my mind as to how I was thinking about things, and it also empowered me to become a little more structured and active in finding those solutions. But it certainly wasn't completion. Then I woke up the next day and Plano fell from the sky. I would rather take the late Steve Jobs approach in thinking it's the dots join, and sometimes some people can see it and sometimes they don't. But for me, I think the whole journey from doing a PhD all the way to this interview, it's starting to make sense.
Right. And you founded Plano in Singapore, like you not in Australia, because of course Singapore is the myopic capital.
So Singapore, Plano is headquartered here. It's a Singapore-based Singapore-based company, sorry, and it's been nurtured here. The team is here, and it was founded and launched here in Singapore.
Yeah.
My connection here to Singapore was straight after, or a year or so after my PhD. I actually did a postdoc here at the National University of Singapore, and it was a big national study on eye disease in the pediatric population of those kids aged 6 to 72 months. And we examined the eyes of these kids with their families, about 3,000 Singaporeans. And so I was in charge of conducting that study here in Singapore. And many years later, I had no idea what the significance of me even being in Singapore was, but it certainly made sense many years later when the penny dropped with Plano.
So what is the reason behind the high rate of myopic population of Singapore?
Well, yeah, I mean, it's not just an Asian disease, but in a nutshell, myopia is a complex condition. So it has both genetic risk factors as well as environmental risk factors. And I think the latter, the environmental risk factors cannot be underestimated, and they play a major part of the development and progression of myopia. So if you think about the risk factors, for a long time, we knew that excessive amounts of near work, and there's big meta-analysis that was conducted several years ago that demonstrate that link between near work activity. So I'm talking about books read per week, studying habits, and so forth. And then with the digitalized world, today we've got in excess of 20 population-based studies showing the link between devices and myopia. And so in actual fact, it's not that the devices are just substituting the books, it's in addition to a lot of the time. And so the amount of time our children, even adults, are spending looking at near material is absolutely mind-blowing. And I had a gut feeling it was going to be a major problem. And it's no surprise to me that our 2-year-olds are spending up to 2 hours a day on devices. 6-month-year-olds are getting already about 45 to 60 minutes of screen exposure. It's that extra babysitter when you're in the pram, and they've got iPad holders in prams now, so children can be looking at something and distracted. But in the meantime, we just got to make sure it's not at the expense of one's health, particularly their eyesight. And so one of these risk factors is near work activity. Second is the benefit of being outdoors. So outdoor activity up to about 2 hours a day is shown to be protective for myopia. And then there's other risk factors as well. The proximity to near material, of course, lighting, and there's other risk factors such as urbanization, educational attainment, and so forth. But if you really sort of bring them in and you think about some of the key ones, it's very much your near work and outdoor and lighting, as well as the genetic predisposition. But environmental and behavior changes can really alter that development progression of the disease.
And
and like I said, in Singapore, if you look at urbanized regions of Asia, it's quite high. If you correlate it with their studying habits and the emphasis on academia, and you also think about the amount of outdoor spent, well, it may explain in essence some of that. Of course, the other is the genetic element, ethnicity as a factor. But what you'll find is that it's become a global issue. So even in the US and Australia, it's doubled in the last 20 years. And so that means that, there's certain behaviors, and we need more evidence to demonstrate this. There's certain behaviors now in this digital world of, the adoption of screens, the excessive use of screens, the lack of outdoor play, and there's an enormous amount of sedentary behavior, so not moving, lack of physical activity. There's a big cultural shift that I think is going to affect different parts of the body, and I'll put my money on it that eyes are affected in the process. Even if you think about the unfortunate circumstances of COVID over the last 12 to 18 months, the collateral or the damage that we're going to probably see in parallel, we're probably already seeing, is that of diet, lack of physical activity, extended times of sitting, excessive screen time for kids, very, very much the myopia and digital eye strain, and this digital eye strain, adults are experiencing it. Because remember, 10 years ago, whatever, we would do some work on the laptop and then we would get up and walk away from our computer. Nowadays, we have the laptop, we have another iPad that's sitting there. We also have the phone that's there. So our mates are texting us on WhatsApp. We're sending off the emails, and and then now with this work at home, we're then, we're Zooming, and so the intensity of screens, the fixation at screens, and the longevity or the excessive use of screens, it doesn't really take a rocket scientist. And this is when the penny dropped through several years ago, and it's more emphasized now that something is going to go wrong. And so this is why we're here, to try and address this problem of myopia with one of its main risk factors of excessive screen time. And don't get me wrong, technology is great. Remember that one of our components of the company is actually using technology, so it's like flipping the problem into the solution. It's quite counterintuitive from a distance, but once you get to understand that we're actually pro-technology. So technology is not the problem, but it's rather the relationship we're developing with technology.
So how do you so what is the Plano technology? How do you ensure that children don't exceed the screen timing, or how do you help their parents to ensure that?
Yeah, it goes beyond just the screen time. So with that first pillar of Plano, the education awareness, of course, we're communicating with different stakeholders, namely teachers, parents, government entities, practitioners, so eye care professionals, as well as children population through different means of print, audio, and visual. And then the application as a technology works in the background of devices, phones and tablets, and it has real-time alerts to ensure that time is adhered to, the correct posture, face to screen, that they're wearing their spectacles, and it also empowers them to adopt good behaviors that are awarded with points that then brings them to our e-commerce element that gets them outdoors. So we partner with a whole heap of vendors that offer outdoor products and services. And so the application is quite, it's non-intrusive, it's non-disruptive, and it's supposed to be a friend of the family rather than a police app, if that makes sense, because we know through research that enforcing type approach doesn't work. And so we've tried to conduct as much market research and focus groups as possible to carefully design the application to ensure good adoption and engagement. So it's real life alerts, it's empowerment with points, and it's functionality embedded in the application that tries to change behavior in line with reducing the risk factors of myopia and digital eye strain.
So have you got any feedback from the kids that this technology is rather enjoyable for them rather than annoying?
Yeah, I think, to be honest, most of it has been in our favor in the way of adoption and use of it, because it's not annoying and we give the kids options. So remember, kids are incredibly smart and tech savvy. One of the things that Steve Jobs wanted to accomplish was he wanted to make his design so slick and so minimalistic or simple that 2-year-olds can use it. Well, he got that right. 2-year-olds can use devices nowadays. They're just so intuitive, and the UX is just beautiful on these devices. So kids, don't underestimate kids. Kids know technology, and so thus far it's been good. In some cases, because remember, we've got parental control functionality, so parents can remotely lock their child's phone, they can block apps, they can enforce the time scheduling a bit more, where there's no device time at dinner and homework time. Then you can understand these kids get a little bit annoyed, and some of them go as far as expressing it on your, the app review, Play Store, App Store, and that's fine too. So we welcome that sort of stuff because with any technology, irrespective of the application, it's very much about continuous product improvement. And so yes, we get all sorts of feedback and we do our best to try and address them.
Right. And you have also patented one of your products, I guess. So can you tell about that?
The patent was actually the application itself, because you must understand that it's quite a complex application in its development. And so it's got very sophisticated functionality, such as, your face to screen, the integration of getting your eyes checked and triggers to know whether a child needs an eye check or not, based on their behavior on the device. The rewards and point system of the Plano application. So there's multiple functionality. So early on, during the incubator stage at the eye center, we did go in and determine that it was patentable, or it was worth pursuing the patent avenue, which is, you probably know, is a very long journey. And so we've got applications in about 10 countries. And thus far, it's been awarded in Singapore. And more recently, I announced that it was awarded in Japan. And so these are very welcoming pieces of news because it protects your IP, but it also demonstrates high value in your software. And software is particularly difficult to patent. But we've been able to achieve that in Singapore and Japan. It's been a long journey, but I think certainly a worthy one.
So what's the competitive landscape like? Like, are there startups that are healthcare startups that have similar products and services as yours?
Yeah, I think in the space of eyes and our ecosystem, we very much lead the market in the world. If you refer to the application in isolation, particularly with the parental control elements such as, tracking location of your child, remotely locking devices, app locking, and so forth. Of course, there's some competition, but we remain very differentiated because we're science-based. We have eye health elements, and the application is part of an ecosystem that's trying to address the global issue of myopia and underutilization of eye care. So we're not a bunch of techies coming in with that quick fix tech app that goes viral, but rather, we're a bunch of techies and scientists coming together to understand what part of this myopia management are we addressing. I think we're addressing the education, telling people what it is, telling them what the solution is in the way of behavior change, and then providing them with the tech solutions. So basically, how can we change their behavior and how can we get them in front of eye care professionals? And that were the missing elements in the health journey, or the natural sort of history of even pre-eye disease, and it can be applied to other health conditions. Actually, that sort of approach, better education is required. Sustainable models of education. I think too many people assume the lay audience understands health conditions. Absolutely incorrect. And it's got to be done in a sustainable, consolidated, digestible way. If you got a scratch on your hand nowadays, or if you're feeling your heartbeat is beating too, and you go off to research, your information is so scattered and it's so rich. There's a lot of it, but it's not easy to navigate through all of this stuff. Right. And so education is a big one. And then second is incentivizing and empowering people to get into these health clinics and systems that governments spend so much money supporting, but without the people in there, their effectiveness can be questioned, actually.
So is the Singapore government taking measures to keep this in check?
Yeah, so we are very fortunate in Singapore for two reasons. Number one, the government is very supportive of innovative solutions, entrepreneurship, and the startup industry in general, really. And so there's a lot of granting bodies, a lot of supportive entities that the Singapore government has put in place to support the growth of startups. From an eye perspective, they're also a bit forward. They're a bit more sort of advanced than neighbouring countries, as well as that of Western places too, where there is a national vision screening system. So it's a good start, and so that enables them to pick up any serious eye conditions or loss of vision. And so we've got partnerships with the Health Promotion Board, where we present on the human eye and myopia and some of the things you could do to change that. So we've presented to over 100,000 children in Singapore across almost 100 schools in Singapore. So it's beautiful to have that support from the Health Promotion Board and the Ministry of Education. You're probably aware of the Plano Adventure series, which are the best-selling books here and internationally. So they're 5-book series.
I guess.
Sorry?
You have written it yourself, I guess.
Well, it co-authored with Hui Go. She's fantastic, and illustrator David Liu, and it's a publishing deal with Marshall Cavendish, who are part of Times Publishing. So, it's very exciting to see these books, and they've been more recently translated in Chinese and distributed in China, with those Chinese copies now available in Singapore. That was a big achievement by the company, because they're not just books, but rather there's a fusion of creativity and science coming together. Their education through entertaining ways, and there are 5 series, talking about myopia, its risk factors, the benefits of outdoor activity, being careful of cyberbullying, and then the gaming, being careful not to be spending too much time on gaming, and then dependency. So there are 5 books, and they're for kids age 4+, and the feedback there has been absolutely fantastic. And so, any opportunity for us to be able to sort of present these books and speak about these books, I jump at it.
That's great. And unfortunately, time is running out, and we have 7 minutes. So I don't think I'll be able to cover all the questions. Okay. So can you tell about your target market? Now you're focusing on children and parents, of course, but is it going to change in the near future?
Yeah. So it's families and adults. So remember that the education awareness is catered for all age groups, and then the tech solutions, the application is primarily for families, so kids, sort of age 2 to 16. And then the Plano eye check, getting people into eye care, that's for everyone. And our AI and the Internet of Things, again, families and adults. And so, with the support of our partners here in Singapore, the government, the health precinct, as well as our VC, and more recently, Santen, which is a giant ophthalmic pharmaceutical company from Japan that's aligned with us, as well as Thomson X, which is an innovative a company that's spun off from Thomson Medical Group. So there's several shareholders here that have played instrumental roles in sort of bringing us to this position. Our team that's made up of about 40 or so people, from technology to data analytics to marketing, business development, researchers, academics, clinicians, and the whole lot of them. Incredibly grateful for their work and coordination and consolidation of all the work we do. And clearly, what the 2 primary objectives moving forward is the big expansion into China. And so we're working on that quite actively. And then second is building on our ecosystem. And when I say building on our ecosystem, it's really much about our Plano application, the Plano eye check, and then of course the big reveal mid-June with the repurposing of our website to make it the world's leading information platform on eye health, and that will be achieved by the end of the year. So we're getting a lot of attention and traffic onto our website, so we're repurposing it to serve that first pillar of our ecosystem, which is education and awareness. I just can't stress how important that is. That's great. And as you said, you are currently in 10 locations. So, so are you planning to expand further in the coming years? So I think the full value proposition will go off to China. But, we're currently in the US, Australia, New Zealand, India, Philippines, Vietnam, Malaysia, and so forth. So there's 10 countries or so. But for now, a lot of our resources and focus is this full value proposition being available in China, and to help them solve this big problem of myopia, where the government has attributed, excessive screen time to about 500 million cases of vision loss in their country. and I think other places will move in that direction. India is leading the research to show the correlation between screen time and myopia. In actual fact, they're one of the first studies, population-based studies that came out of India. And so, I think our focus will be there, even though we're present in 9 other countries. I think, having the app there is fine, but the full value proposition will be going to China. So we're all very excited about that too.
That's great. And so finally, I'd like to ask you, what advice would you give to everyone, like in general, on how we can protect our eyes or decrease our eye power in general?
Yeah, I just think being conscientious about health checks, regular health checks is important, and seek advice from your doctors, and don't neglect your eyes. Your eyes are part of your brain, and don't take them for granted, because a lot of diseases sadly develop without you developing the symptoms first. So there could be a whole heap of pathological changes taking place. In the way of technology or screens and so forth, I think these are tools created by humans, and it's up to us as conscientious people to use them for the tools they are and ensure that they don't make tools out of you. So avoid, becoming dependent. Like the WHO has, defined gaming disorder and internet addiction syndrome. They're going to probably come out with something that's associated with our attachment with social media platforms too. So please use them for the tools they are. Be conscious about this, and get outside, get outdoors, get into nature.
Right. Well, all the best to you for all your future plans for Plano, and it was great chatting with you.
Thank you very much. I appreciate this, and thank you for your company, independently going out there and ranking startups. They probably found us as because we more recently won the most innovative health tech company, health tech startup, in the world. So it's very humbling, and we're very appreciative, and the team's very excited. And thanks for this opportunity for the interview. Pleasure.
You're welcome. Thank you for joining in.
Pleasure.
Okay, have a great day.
You too.
Bye.
Bye-bye.